we want to endorse, following on from Brian's pen picture, that we do appreciate how hard NHS staff are working and have been working over this period. And although we're looking at some very depressing figures in some senses, obviously we do recognise the resilience of our local A&E and hospital staff, so I think we should record that. And equally, I'd want to record appreciation for the work that adult social care staff are doing, who are working on a 7-day basis, particularly around hospital discharge. So, I mean, despite the problems we're examining tonight, I think we do have the basis of some very good joint working. And in picking up on Patrick's point, I think we've got some ambitious plans together, also working with the CCG to progress our joint services. Later in the agenda, we're going to be talking about the abolition of home care charging, and I think the fact that we won't have a system which is means tested alongside NHS care, which is free at the point of access, is also going to help us in our joint working. I've got a couple of questions looking at some of the remedies that you're putting in place, and in many senses it's music to our ears, because you're obviously investing in our local A&Es in a way that is very gratifying. Previously, under the Shaping a Healthier Future discussions, we were told it was impossible to be recruiting more A&E consultants, more senior and experienced A&E clinicians. That was a driving force for having to rationalise and reduce our A&Es. So it's very good that you've been able to attract people. And from what you're saying, I'd like you to clarify that the consultants and senior clinicians are actually on site and available to both see people directly and advise more junior staff, because again, in thinking about the model of a reduced A&E that we appeared to be saddled with, we were told quite specifically by Dr. Spencer that we wouldn't have access locally to an A&E consultant on site. So it seems as if for the moment we're going in a different direction. I'd like to know more about the wider review, the independent review. Does this mean that Shaping a Healthier Future is no longer sacrosanct, and that there is some fresh thinking and really looking at demands and the demographic features in our areas, and perhaps listening to what many people said was flawed in the plans to reduce our A&Es? Also, we haven't really talked about the knock-on effect of bed usage. So clearly people have been admitted to beds. We've been reading in our local media and nationally about the cancellation of elective surgery, and that's been a particular issue, I think, locally for Imperial, people who've had their operations postponed.